So asthma is a chronic inflammatory disease of the airways characterized by what we call bronchoconstriction or airway tightness. What I would want my patients to know about asthma is the fact that it can affect anyone. Globally, around 300 million people are affected by it, and in the US in itself, around 8% adults, around 10% of children get affected by it. It can affect, like I said, all age groups. So even though a majority of our patients do develop asthma as a child, which is known as childhood onset of asthma, we are now seeing more recently what we call adult onset of asthma as well. Patients who have adult onset of asthma might not have a known exposure or trigger, but their airways are responding to chronic inflammatory state, including, for example, obesity or exposure at work, woodwork, fumes, etc. There are other triggers which can be under-recognized. Sometimes patients present with what we call persistent dry coughing. That means they have had either an exposure to an upper respiratory tract infection, after which now they're having persistent coughing. This can actually be a symptom of underdiagnosed asthma. Their airways are hyperresponsive and now they're responding by bronchoconstriction to that infection. More often, patients who have had either increased flare-ups or they have had persistent symptoms require a maintenance inhaler. This inhaler is an inhaler that you will take no matter how you're feeling every day. And this helps reduce the inflammation in the airways. These maintenance inhalers are often going to have inhaled corticosteroids, which helps out with that. Apart from inhalers, there are other things that a patient can do, which is often lifestyle modifications to help control the asthma. That would be one, identifying and avoiding triggers. Number two would be things like smoking cessation. Three, weight reduction, and sometimes even often diet changes. If there's one thing I would want my patients with asthma to know is early recognition of symptoms of asthma flare-up is key. That's because we want to take early good steps to make sure it doesn't go into an asthma exacerbation. This is often going to involve oral steroids. So in short, I want my patients not to brave through the symptoms and let the physician know early.